Welcome to Health Talk. I'm Dr. Manny. With 300,000 new cases of Lyme disease each year, it's no surprise that tick-borne illness has been a hotly debated topic among medical experts. Joining me now is New York Times best-selling author of Why Can I Get Better? Solving the Mystery of Lyme and Chronic Disease, Dr. Richard Horowitz. Welcome to the program. Hot topic indeed. Lyme disease is so prevalent, and there's a lot of confusion and myth in regards to to this problem. So tell me, why is it a chronic disease? How is Lyme disease evolving in this country?
Well, the problem is the CDC did come out and say that there are over 300,000 cases now. Right. And the problem is that the ticks are now coming out even 3 weeks earlier with these global warming changes. So we have patients now coming in with tick bites. People are moving into urban areas. They're getting these bites. The nymphs are very small. You may not see them. And the problem is the ticks are containing not just Lyme disease, but other bacteria, other viruses, parasites like Babesia, which is a malaria-like illness. So with one tick bite, you can get multiple organisms all at the same time, and many people get chronically ill from this.
Let's try to educate the public a little bit, because I think that one of the biggest problems with Lyme disease is diagnosing Lyme disease. So what should if you suspect that the patient has Lyme disease, what tests do you do in order to make the proper diagnosis?
Well, first of all, Lyme is a clinical diagnosis.
Right.
The CDC even said years ago that the testing should only be used by health departments to epidemiologically screen large populations. So right. The first test that doctors do usually is an ELISA test. The problem with the ELISA is it lacks sensitivity. It's like a coin flip. You'll pick it up in half the cases. I was speaking to Ben Beard of the CDC a couple of months ago, and he was suggesting the C6 Lyme ELISA peptide. It's a little bit of a better test than the regular ELISA. But the problem, there's over 100 types of Lyme, these strains of Borrelia in the United States, and 300 worldwide. So the Western blot, the second test that people do, it won't always pick it up.
Right.
So I play a game with my patients called Lyme Bingo, which is you look at the Western blot, and if there are 5 numbers or bands on the Western blot, any one of these means you've been exposed to Lyme.
Right.
So the 23, 31, 34, 39, and 83, 93 bands, these are specific for Lyme.
Now, one of the things you said is that a lot of the diagnosis is made on the clinical presentation of the patient. Now, the clinical presentation of Lyme disease can mimic many other things, like arthritis, fibromyalgia, things of this sort. So how do you kind of decipher that a little bit?
Right. Lyme is known as the great imitator, and it's true. It's very difficult for doctors sometimes to make the diagnosis because, as you said, it imitates chronic fatigue syndrome, fibromyalgia, autoimmune diseases like MS. I have a lot of MS patients coming in that have Lyme. Can mimic rheumatoid arthritis, ALS, psychiatric. I've had patients with anxiety, depression, OCD, schizophrenia, where I give them doxycycline and they get off their psych meds.
So let's talk about the treatment.
Yeah.
The treatment is with antibiotics.
Yes.
Okay, for how long and how,
It depends on the patient. If they go past 30 days, it's not easy to cure this disease. It's curable. 75 to 80% can be cured with antibiotics like doxycycline or Ceftin within the first 30 days. The problem is when people go past 30 days and they get this multisystemic disorder where they're tired and they have these migrating aches and pains that are moving around their body, tingling, numbness, burning that comes and goes and moves around, memory, concentration problems. You walk in a room and you can't remember why. You can't fall asleep. You keep waking up. You have day sweats, night sweats, and chills. You're tired, a stiff neck, a headache. All of these symptoms can be symptoms of Lyme, but they also can be from Babesia, from other co-infections.
So if I get exposed to Lyme disease, I don't realize it, time goes by, now it's a year later, I still feel terrible, and then I go see you, I put 2 and 2 together, and you check me, and you say, look, it looks like this is Lyme. Can I get better with chronic, now that I have a chronic condition, year post-Lyme disease?
Yes, you can. There is hope for people with chronic Lyme. I found that there's up to 16 reasons why people stay ill with Lyme. One of the largest parts are these co-infections in the ticks like Babesia. Over 80% of the time, this malarial organism, it's a parasite.
Right.
It's getting into people, making them sick. So the ones who have day sweats, night sweats, chills. I had a woman in a wheelchair for 6 years, paralyzed from the waist down. She couldn't get up. She cost New York State over $500,000 in disability. Within 10 days of treating the Babesia with antibiotics and antimalarials, she was walking. So there is hope for people.
Now, in the medical community, because you happen to be one of the world experts on Lyme disease and everything related to it. But in the medical field, there is a lot of controversy in the sense that they don't believe in chronic Lyme disease. I don't get that. Why don't they believe that there's chronic Lyme disease?
Yeah, there are two sets of guidelines for diagnosing and treating Lyme. One is by the Infectious Disease Society of America, and the other is by ILADS. And I was one of the founding members of ILADS, the International Lyme and Associated Disease Society. These two guidelines are different. One says the tests are reliable and you can cure it with 30 days, and the other guidelines say you can't. Right now, the IDSA are redoing their guidelines. The Lyme groups have sent extensive scientific references to the IDSA on how poor the testing is and that Lyme can persist. So hopefully this controversy, the politics of Lyme right now is really interfering with doctors knowing what to do. But we really need to put our swords aside because we're in the middle of an epidemic. This is the #1 vector-borne spreading epidemic in the U.S. We've got to put our swords aside, and we've got to put patients first and get to the table and find solutions.
What is that is creating the epidemic?
It's all of it. In fact, I've named the deer in my backyard. That's how often I see them at this point in time.
Right.
But yes, it's because of the deer, but also the white-footed mouse, but it's also chipmunks, raccoons, foxes, moles, voles. The ticks are now even on birds. The reason it's a worldwide epidemic is the ticks get on birds and they go to Canada, they go to China. When I was in China and I was speaking with their CDC, because I was over there for a week, they told me privately 6% of the Chinese population had been diagnosed with Lyme.
And as you said, it's also now that there's new types of, viruses and bacilli being identified in ticks beyond Lyme.
Yes, I mean, it's dangerous. You need to do prevention because one of the viruses we're now finding, the Powassan virus, can get into your body within 15 minutes of a tick bite. And the mortality rates are 10 to 15%, up to 30% in some studies.
Right.
So you could get multiple viruses, Borrelia miyamotoi, a relapsing fever bacteria, a malarial organism like Babesia with one tick bite, and it overwhelms the immune system. And that's one of the reasons people don't get better.
So now the summer is coming. People are going to be outside. We had a harsh winter all throughout the U.S. What should we tell people to do?
So it's important to do tick checks. You wear light-colored clothing. You can spray permethrin spray. You can get this. It's based on chrysanthemum. It's from a flower.
Right.
You spray this on your clothes. It will repel the ticks for 1 to 2 weeks. You can use D 20% or higher if you're in a really highly endemic area, but you have to be careful because of the neurotoxicity. But you do tick checks when you come inside. Check all around the body. Use tweezers or other tick removal devices to get underneath and pull it. You do not squeeze them because you will get the organisms into your skin.
And if I find a tick in my body and I take it off, do I go to the doctor? Do I wait for a rash? What do I do?
It's good to send the ticks to the health departments to check the ticks to see if they have Lyme. You can put it in a little vial and send it out. Most of the health departments will do this. But you can't always wait for a rash because less than half of the people get rashes and 25% don't even look like bullseyes. You must know the symptoms of Lyme disease and what to do, but if the tick has been on and it starts to get engorged, and it's on even for several hours, and it's been difficult to remove, you may want to speak to your doctor about taking antibiotics because I've seen over 12,000 people with this disease over 28 years, and prevention and treating early with antibiotics can cure the disease.
All right, well, thank you very much. Again, the book is Why Can I Get Better? Solving the Mystery of Lyme and Chronic Disease. And it's very important because we're talking to one of the greatest experts on Lyme disease, and it is a problem that is getting worse and worse and worse and worse. And, just like you say, Lyme disease is a great imitator, so people get confused, but, there's help on the way. Thank you. And people can get the book anywhere, right?
Yes, it's on Amazon. It's on all the sites, and they can read more.
You have a website?
Yes, my website is cangetbetter.com.
All right, well, thank you so much for coming.
My pleasure.
And if you have any health questions, you can send them here at Fox at drmanny@foxnews.com. Until next time, I'm Dr. Manny.